another major change today at the CDC. HHS Secretary Robert F. Kennedy Jr. has now named his deputy, Jim O'Neill, as acting CDC director amid a tumultuous shakeup at the agency. O'Neill is set to take over after Director Dr. Susan Menarez was fired this week, a position that she held only a few weeks after getting confirmed by the Senate. And O'Neill was actually there for her swearing-in ceremony in late July. We're learning that Dr. Menarez was pushed out after clashing with Kennedy over vaccine policy. Her ousting led several other high-ranking CDC officials to resign in protest. And O'Neill's appointment is already raising eyebrows. He doesn't have a medical degree or an advanced degree in public health. That's a first for any CDC director, acting or not. During the COVID pandemic, O'Neill also openly championed unproven, controversial treatments like ivermectin. CNN's Jacqueline Howard joins us now live from Atlanta. So, Jacqueline, what more are you hearing about Jim O'Neill?
Well, Boris, I know many CDC employees have said that they want to know where his priorities lie, what his stance is on vaccine policies, because as you mentioned, there are many questions just around his background and his philosophies here. Now, during his confirmation hearing to serve as HHS Deputy Secretary, he did say that he supports vaccines. Have a listen.
Senator, as you know, I'm very strongly pro-vaccine. I'm an advisor to a vaccine company. I support the CDC vaccine schedule.
And Boris, we also know that, as you mentioned, Jim O'Neill is not a doctor, but he does have history within the Department of Health and Human Services. He did work there during the George W. Bush administration. And we know in recent years, he has spent years as a technology and biotech investor in Silicon Valley. He had stints with the Thiel Foundation and the Thiel Fellowship, working alongside billionaire Peter Thiel. But as we see him next as acting CDC director, like I said, there are these questions around where he will steer the ship at CDC, especially when it comes to vaccine policies.
And vaccine policies, Jacqueline, top of mind right now as we're heading into autumn, a time when many people might be getting their flu shots, their COVID shots. But the FDA this week approved the updated COVID-19 vaccines for a limited group. And in some states, you might not actually just be able to walk into a pharmacy and get the shot anymore. So who is now eligible for a vaccine this year and where?
That's right, Boris. The groups that are eligible are adults ages 65 and older and younger people who are at an increased risk of severe COVID-19. So that may be due to an underlying health condition. But in some states have a policy where pharmacists cannot offer vaccines that are not recommended by the CDC's Advisory Committee on Immunization Practices. And I spoke with CVS Pharmacy. They said that in some of those states, in 16 states, you can't just walk in to a pharmacy and be offered the COVID-19 vaccine. Among those states, all but three, however, in those all but three states will have pharmacists administer vaccines if you have an authorized prescriber's prescription. So in some states, you need the doctor's prescription to get your COVID shot, Boris.
Jacqueline Howard, thanks so much for the reporting. Brianna?
Some of the officials who resigned from the CDC are raising serious questions about the decision making at HHS. Here's what one of them told CNN's Caitlin Collins last night.
I think that another important thing to ask the secretary is, has he been ever briefed by a CDC expert on anything, specifically measles, COVID-19, flu? I think that people should ask him that in that hearing. That's number one. So the answer is no. So no one from my center has ever briefed him on any of those topics.
Let's bring in Dr. Leana Wen. She's a former Baltimore Health Commissioner and emergency physician. Dr. Wen, what is your reaction to that, hearing that Secretary Kennedy has not been briefed on those important subjects?
Well, it's very disturbing. I mean, we're talking here about the CDC, which is the premier public health institution, not only in the US, but worldwide. Other countries name their health agencies the CDC after the US because of its storied history. And so the fact that we have all these incredible experts, subject matter experts who are the best minds in the country, physicians, scientists with many years of experience working there, who have the data, who can provide the analysis, and I know from having spoken to many of them, they're eager to brief Secretary Kennedy. They're eager to help to make America healthy again and to fulfill that agenda for promoting health and well-being. But the fact that their expertise has not been listened to makes you wonder, who is Secretary Kennedy listening to? Where is he obtaining his data? How is he making decisions if it's not based on these key subject matter experts? And I'm really worried, Brianna, about what's going to happen with vaccine policy, because we have seen that with the ouster of the CDC director, who has said that the reason for the ouster, part of the reason for the ouster, is that she was asked to sign off on changes to vaccine policy, not based on science. And so without that safeguard being there of a CDC director willing to push back, then what's going to happen to not just COVID vaccines, but also to routine childhood immunizations?
Yeah, certainly. The FDA under Kennedy has restricted the groups that COVID shots are approved for, but says that COVID shots are still available for everyone. Are COVID shots easily available if you want one, Dr. Wen?
Well, we have to be clear that right now it's only the FDA that has made its decision regarding approvals. The CDC still has to make its recommendations. And those CDC recommendations are very important because that's what the pharmacies, that's what physicians' offices, that's what insurance companies are going to follow as well. And it could be that the CDC recommends the vaccine for all the groups that currently are eligible under the FDA's authorization or under the FDA's approval. But the CDC could actually come out and limit the approvals even further. And so even those groups that Jacqueline was talking about that currently the FDA has given approval for, it's possible that some of those groups may not have easy access based on what the CDC puts out. And we also know that Secretary Kennedy has ousted all 17 previous members of the advisory committee on immunization practices that advise the CDC, these external experts that advise the CDC on COVID and other matters. And there are now individuals in place with dubious qualifications, some of whom have some quite significant anti-vaccine history. And so I would not say that it's a guarantee that even the groups that are approved by the FDA are now going to be able to get the COVID vaccine.
You wrote for the Washington Post, and this is the point you just brought up about being worried about vaccines writ large. You say limiting COVID shots is just the beginning. Childhood vaccines are next. What do you think is going to happen? What should we prepare for?
There are already some very ominous signs. This advisory committee that I mentioned, reconstituted by Secretary Kennedy, they are already reviewing childhood vaccines on the immunization schedule, including hepatitis B, including measles, mumps, rubella, varicella, or chickenpox. Secretary Kennedy has also said that he has some big announcement in September regarding autism. And given his history, where he has falsely linked autism and vaccines, one wonders whether there is already a predetermined conclusion, and now there are cherry-picked data that he and whoever he's listening to, not the CDC experts, but whoever he's listening to, have come up with to try to justify why certain childhood vaccines should be removed from the schedule. Now, we don't know that this is exactly what's going to happen, but there are many signs that that could be the case. And I certainly know from speaking with my colleagues who are pediatricians, who are public health experts, this is something that we're all watching closely and that we're all deeply concerned about, because we're talking here about vaccines that are effective, that have been safe, that have been used all around the world, that have been proven to save many lives. And the fact that we could be going back in time and having children suffer unnecessarily is just really a horrific thought.
Yeah. Dr. Leana Wen, thank you for being with us.